back to talk about bone development. We're just going to talk about the two mechanisms of bone formation. Bone is called ossification, or sometimes referred to as osteogenesis. Osteo means bone, genesis means the beginning or formation, so the formation of bone. And there are two methods of bone development. Both of those begin with the embryonic mesenchyme stem cell line. There is intramembranous ossification and endochondral ossification. Start first with intramembranous ossification. This process is going to produce the flat bones of the skull, part of the mandible, and most of the clavicle. So the clavicle is your collarbone and your mandible is your lower jawbone. We can break this process down into four main steps. The first step is going to be the deposit of osteoid or bone tissue into an embryonic mesenchyme. And then we'll have calcification of the osteoid tissue and entrapment of osteocytes where they get captured in their lacuna. Then we'll have the honeycomb of spongy bone with developing periosteum, and then the filling of space to form compact bone at the surfaces, creating a sandwich with the compact bone, then a layer of spongy bone in the middle, and another layer of compact bone. This type of ossification is very important in lifelong thickening and remodeling of long bones. We're going to go over each of these four images and just note that they are drawn to different scales. The most zoomed in scale is in the first image, and then we're going to basically zoom out as we go over the next images. Orientate ourselves with this diagram before we start talking about the intramembranous ossification process. So what we're looking at here are some blood vessels. Wherever you see these red tubes are blood vessels, and then these other red ovals are also blood vessels. They are just going through the tissue in a different direction. So it's as if you cut a straw in half and you're looking through the tube of the straw. So these blood vessels are lined with osteoblasts, those cells that build bone. And then there's going to be a layer of osteoid tissue because these blasts are bone builders. And then we have some mesenchyme cells, which are represented by these kind of ovals, and they are in this mesenchyme. So the mesenchyme first will condense into a soft sheet of tissue that we see here. And it is permeated with these blood vessels. The membrane to which the intramembranous refers to, that's what we're talking about here. So mesenchymal cells will line up along the blood vessels, and they will differentiate to form or become osteoblasts. And those osteoblasts are the cells that build the bone tissue. They secrete soft collagenous osteoid tissue or pre-bone in the direction away from the blood vessel. Osteoid tissue resembles bone, but it's not yet calcified. The osteoblast will then sprout out numerous dendrites or projections from their cell bodies that are delicate but they can penetrate into the osteoid tissue. This is going to promote the deposit of calcium phosphate as well as other minerals onto the collagen fibers of that osteoid tissue. This is going to harden that matrix, and continued osteoid deposits and mineralizations will start to squeeze the blood vessels and future bone marrow into more narrow and narrow spaces. They will also then become surrounded by a calcified matrix, and the osteoblast gets trapped, and he is going to be then become an osteocyte. And the little space that he lives in is called the lacuna. So their bodies inhabit the lacuna, but they still have those dendrites that can reach out into these canal-like projections that will connect lacuna to lacuna. And those little projections are called canaliculi. And the dendrites from these osteocytes will reach through those canaliculi so they can communicate with one another. At the same time of those other processes, more mesenchyme adjacent to the developing bone marrow is going to condense. And as it condenses, it forms a fibrous periosteum on each surface. And then the spongy bone becomes a honeycomb of slender calcified trabeculae. And so we start to see those little beams form. And in between those spaces of trabeculae, we are going to find that red marrow. So at the surface, osteoblasts are located beneath the periosteum, and they deposit layers of bone that fill the spaces between the trabeculae and create a zone of compact bone on each side, as well as thicken the bone overall. This process gives rise to that sandwich-like structure typical of a flat cranial bone. And so we're going to have this layer of compact bone, then spongy bone, and more compact bone. So the spongy bone will keep those trabeculae, while the compact bone will be replaced by those osteons. So if you take a note here, this is a histology image of the fetal cranium. And you can make note of the layers of osteoid tissue. There are the osteoblasts and fibrous periosteum on both sides of the bone. This process of intramembranous ossification is also going to play a very important role in the lifelong thickening, strengthening, and remodeling of long bones. After all, these bones are very dynamic tissue and they're living. Your skeleton's replaced like every 7 years. So throughout life, there is the skeleton that has this method of depositing new tissue onto the bone surface, even past the age where the bones can no longer grow in length. Endochondral ossification is a different process in which bone develops from a pre-existing model that is composed of hyaline cartilage. This will begin around the 6th week of fetal development, and it continues into a person's 20s. This is the way most of the body's bones develop, including the vertebrae, the ribs, the sternum, the scapula, your pelvic girdle, and the bones of your limbs. So the stages of the endochondral ossification, if we use a long bone for an example, is that the mesenchyme is going to form an early cartilage model. Right? Instead of going directly to bone, we're going to have cartilage built by chondroblasts. And then we're going to have a formation of a primary ossification center where that cartilage is going to be converted to bone. And there will be a bony collar as well as the formation of the periosteum. Then we're going to have invasion of blood vessels and formation of a primary marrow cavity, and then the appearance of a secondary ossification center. At birth, the bones, specifically the long bones, will contain an enlarged marrow cavity, and then there will be a secondary marrow cavity in 1 to 2 of the epiphyses, depending on what bone we're talking about. As a child continues to grow, there is going to be some cartilage left over in the portion of the bone where the epiphysis meets the diaphysis, called the metaphysis. And that cartilage is called the epiphyseal plate. So that's where we're actually going to have bone growth and bone elongation. We can't have bone elongation happen at the ends of the bone because that will interfere with the articulations with other bones. And once we have an adult bone, that will contain a single marrow cavity and the epiphyseal plate will be closed. So there'll no longer be cartilage there. It will be all ossified, but we'll see the remnants of a line called the epiphyseal line. This figure shows the steps in endochondral ossification, specifically using a metacarpal bone from the palmar region of the hand as an example, just due to simplicity. And this metacarpal will only have one epiphyseal plate or growth center, while many other bones will develop in more complex ways, having an epiphyseal plate on both ends or multiple plates at each end, but the basic process is going to be the same. So, little challenge, and you can pause the video to answer it, but can you name at least 2 specific bones that would have 2 epiphyseal plates? So there would be one at the proximal end and one at the distal end, and they would resemble this image here in stage 5. Well, pause if you need more time, but that would be bones like the humerus, the radius, ulna, femur, tibia, or fibula. With endochondral ossification, the first step is going to be an early cartilage model. And that is when the mesenchyme will develop into a body of hyaline cartilage that is covered with a fibrous perichondrium in the location of a future bone. So notice the roots that I'm using are chondro, which means cartilage. So we have the perichondrium, not periosteum. So it's the area around the cartilage. And then we're going to have enlarging chondrocytes, right? So those are going to be cartilage cells. For a time, the perichondrium will produce chondrocytes and the cartilage model will grow in thickness. So we're going to have this formation of a primary ossification center in the middle-ish of that bone. In the primary ossification center, the chondrocytes are going to begin to inflate and die within the walls because the walls are beginning to calcify. The perichondrium is going to stop producing chondrocytes and it will begin producing osteoblasts. These will then deposit a thin collar of bone around the missing cartilage model, reinforcing it kind of like a napkin ring. The former perichondrium is now considered the periosteum, as the chondrocytes in the middle of the model die. Their lacuna are going to start to merge into a single cavity. So blood vessels are going to be able to perforate and invade into that primary ossification center, delivering blood-borne osteoclasts that will start to digest any calcified tissue and create a hollowed out center called the primary marrow cavity. It's also referred to as the medullary or medullary cavity. The osteoblasts will also arrive and begin to deposit layers of bone lining the cavity, thickening the diaphysis or shaft. As the bony collar under the periosteum thickens and elongates, a wave of cartilage death progresses towards each end of the bone. And then osteoclasts in the marrow cavity follow this wave of dissolving cartilage remnants and enlarge the marrow cavity of the diaphysis. The region of transition from cartilage to bone at each end of the primary marrow cavity is called the metaphysis. Soon, the chondrocyte enlargement and death and vascular invasion will occur in the epiphysis of the model, creating a secondary ossification center. In the metacarpal bones, like what this figure is showing, this is only going to occupy or happen in one epiphysis, but in longer bones like the arms and of the legs, it's going to occur in both ends. The secondary ossification center hollows out by the same process of the diaphysis, generating a secondary marrow cavity in the epiphysis. This cavity will expand outwards from the center in all directions at the time of birth. The bone typically looks like step 4 in the figure. In the bones with two secondary ossification centers, one center will lag behind the other, so at birth there is a secondary marrow cavity at one end, while chondrocyte growth has just begun at the other. The joints of the limbs are still cartilaginous at birth, and they begin to fuse after birth, but they're basically mush when they're like in a 12-week-old fetus. So during infancy and childhood, the epiphysis will fill with spongy bone. The cartilage is then limited to the articular cartilage covering each surface joint and to the epiphyseal plate, that little thin wall of cartilage separating the primary and secondary marrow cavities at one end of the bone or both ends of the bone. The plate persists throughout childhood and adolescence and serves for a growth zone for bone elongation. Okay, so as a child grows, we're going to have these tall columns of chondroblasts that will lay down cartilage as a template. And this is going to happen at the epiphyseal plate. And so if we are thinking about like the anatomy of the bone, this is occurring in the metaphysis. And you're going to have the epiphysis over here, right? And then the diaphysis is going to be over here on this side. So these dividing cartilage cells, these chondroblasts, are going to lay down a template on the epiphysis side of the growth plate. And then we're going to have that cartilage begin to deteriorate. And it deteriorates as the matrix around it starts to calcify, right? And that calcification is happening because of osteoblasts. They are coming in with blood supply and with the blood supply, and they are starting to build bone by calcifying the matrix, and they are forming a spongy bone. And then we're going to have osteoclasts come in and secrete an acid to enlarge the marrow cavity or medullary cavity as the bone grows. Because if it was completely filled with bone, that bone would get really dense and heavy. So we have to keep the ratio of the cavity the same, and we're going to start hollowing that out. So the bone will continue to grow in length. So this ossification is going to occur on the diaphysis side of the growth plate. By the late teens to early 20s, all of the remaining cartilage in the epiphyseal plate is going to generally be consumed, and the gap between the epiphysis and the diaphysis will close. The primary and secondary marrow cavities will then unite, and they will form a single cavity. Here you're looking at a 10-week-old human fetus that's been specifically stained to show the skeletal elements. So these are bones that have been ossified. And what you're looking at is like the development of the ribs, future hip bones, the femur, the tibia, as well as the roofing of the bones of the skull, so like the sphenoid. And the cartilaginous portion of the bone is all of this portion, which is kind of like the tan. At just 16 weeks, the intramembranous bones are now completed in the roof of the skull and most of that appendicular skeleton at this stage. The cartilage is beginning to be replaced through endochondral ossification. So the red stained regions are calcified where at this age where we're looking at a 12-week-old fetus. And the elbow, wrist, and knees and ankle joints, those appear translucent. So if you just think about the question, why are the joints of an infant weaker than those of an older child? Well, pause if you need more time. It's because those joints they're not ossified yet. There's still a lot of cartilage, right? Like here we don't have our carpals. They're not ossified yet. In the hip bones and in the fontanelle, that soft spot between the parietal bones and the frontal bone, those still need to be ossified. So with the next lesson, we'll go over bone growth and bone remodeling.